Did you know that the most dangerous part of a heart attack is not the event itself, but the first few minutes of indecision? In that small window of time, a battle is waged not just in the arteries of the heart, but in the mind. It's a battle between denial and action, between "it's probably nothing" and "I need help right now." For every minute that denial wins, a piece of the heart muscle can be lost forever. The tragic reality, seen in emergency rooms every single day, is that almost half of all people who die from a heart attack do so before they ever reach the hospital. They die in their living rooms, in their gardens, in their beds, because they waited too long. This is not a conversation meant to create fear. It is a conversation designed to dismantle it. Fear thrives in uncertainty, but it withers in the face of knowledge. Today we are going to arm you with that knowledge. We are going to embark on a deep, comprehensive journey to understand the language of your heart. We will learn to recognize its whispers, its warnings, and its desperate cries for help. This is a senior's guide to understanding heart attack symptoms, because as we age, the signs can become more subtle, more confusing, and easier to dismiss as just another ache or pain of getting older. But the truth is, this knowledge is the most powerful life-saving tool you will ever possess. It is the key that can turn a potential tragedy into a story of survival. Before we can understand the symptoms, we must understand what a heart attack actually is. Let's demystify it. Forget the complicated medical jargon. At its core, a heart attack is a plumbing problem. Your heart is a powerful muscle, and like any muscle, it needs a constant supply of oxygen-rich blood to function. This blood is delivered through a network of small pipes called coronary arteries. A heart attack happens when one of these pipes becomes blocked, usually by a blood clot that forms on a buildup of fatty plaque. When the pipe is blocked, the flow of blood is cut off. The section of the heart muscle that was being fed by that artery is now starving for oxygen. And if blood flow isn't restored quickly, that part of the muscle begins to die. This is why we have the most important phrase in all of cardiology: time is muscle. The longer the artery remains blocked, the more heart muscle is permanently damaged. The more damage there is, the weaker the heart becomes, which can lead to future problems like heart failure. The goal of every paramedic and doctor is to open that blocked artery as fast as humanly possible. But they can't start that process until you make the call. Your role, the most critical role in the entire chain of survival, is to recognize the problem and activate the emergency response system. That's why understanding these symptoms isn't just an academic exercise. It is the first and most important step in saving your own life. Let's start with the symptom that everyone thinks they know: chest pain. This is the classic, Hollywood-portrayed sign of a heart attack. But the word pain itself can be dangerously misleading. For many people, especially seniors, it's not a sharp, stabbing pain like a knife. It's often a feeling of discomfort, of pressure, of squeezing, of fullness, or a heavy ache. The most common description patients give is that it feels like an elephant is sitting on my chest. Others describe it as a tight band being squeezed around them. This sensation is typically felt in the center of the chest, or perhaps slightly to the left. It's a deep, internal feeling, not a surface-level pain that you can pinpoint with one finger. A key characteristic is its persistence. This is not a fleeting twinge that lasts for 2 seconds and then disappears. A heart attack discomfort typically lasts for more than a few minutes, or it may go away and then come back. It might start as a mild pressure and gradually build in intensity. This is the signal that is most often mistaken for heartburn or indigestion. A person might think, "Oh, I shouldn't have had that spicy meal for dinner." They take an antacid and decide to wait it out. This is a gamble with the highest possible stakes. While it is true that indigestion can cause chest discomfort, if the feeling is new to you, if it feels heavier or more intense than your usual heartburn, and especially if it is accompanied by any of the other symptoms we are about to discuss, you must treat it as a potential heart attack until proven otherwise. Now let's talk about where that chest discomfort can travel. The nerves in our body are like a complex highway system, and sometimes the pain signals from the heart get rerouted and show up in other locations. This is called referred pain, and it's a critical concept to understand. The most well-known location for this referred pain is the left arm. It might feel like a deep ache, a heaviness, or a numbness that runs down the arm. But it is crucial to know that it is not always the left arm. It can be the right arm, or it can be both arms simultaneously. The pain can also travel up into your neck, your jaw, or your back. A person might mistake this for a dental problem, a pulled muscle in their neck, or think they just slept on it wrong. A classic scenario involves a senior who develops a persistent, aching jaw and schedules a dentist appointment for the following week, not realizing it's their heart crying for help. Similarly, pain in the upper back, often described as a feeling of pressure between the shoulder blades, is another common site of referred pain. The key takeaway is this: a heart attack does not live by a rulebook. Any new, unexplained, and persistent discomfort in the entire upper torso, from the jaw down to the navel, should be considered a potential warning sign. Think of your chest as the epicenter of an earthquake. The shaking might be felt most strongly there, but the tremors can be felt in many surrounding areas. Let's move on to our second major symptom, which can occur with or without any chest discomfort at all. This is shortness of breath. The medical term is dyspnea, but the feeling is unmistakable. You feel like you can't get enough air. You might be sitting perfectly still in your favorite chair, not exerting yourself at all, and suddenly feel as though you've just run up a flight of stairs. Why does this happen? It goes back to our plumbing problem. When the heart muscle is damaged and can't pump blood effectively, blood can start to back up in the system. This backup can cause fluid to leak into the lungs, making it very difficult to breathe. For some people, particularly older adults and those with diabetes, shortness of breath may be the one and only symptom they experience during a heart attack. They may feel no chest pressure at all. This makes it incredibly easy to dismiss. A person might think it's their asthma acting up, or perhaps a sign of a burgeoning cold. But if the shortness of breath comes on suddenly, without any clear reason, and doesn't resolve when you rest, it is a massive red flag. It's your body's way of telling you that the entire system is under stress because the central pump, your heart, is failing in its duties. The next group of symptoms can be thought of as the body's systemic reaction to the crisis unfolding in the chest. These include breaking out in a cold sweat, feeling nauseous or vomiting, and experiencing dizziness or lightheadedness. Let's break these down. The cold sweat is a very specific and telling sign. This isn't the kind of sweat you get from working in the garden on a hot day. It's a clammy, cool, and often profuse sweat that occurs when your body goes into a fight or flight response. Your nervous system recognizes that something is catastrophically wrong, and it triggers the stress reaction. Your skin may feel cool and clammy to the touch, even as you are sweating. Nausea and vomiting are also incredibly common. The same nerves that can cause the chest pain to feel like indigestion can also upset your stomach, leading to a powerful feeling of sickness. This is another reason why so many people mistake a heart attack for a stomach bug or food poisoning. Finally, dizziness and lightheadedness occur because the damaged heart isn't pumping enough oxygenated blood to the brain. When the brain is deprived of its fuel, you can feel faint, unsteady on your feet, or as though the room is spinning. For some, this can even lead to a full loss of consciousness or syncope. If any of these symptoms, a cold sweat, nausea, or dizziness, appear alongside chest discomfort or shortness of breath, the likelihood of it being a heart attack increases dramatically. One of the most important and often misunderstood aspects of heart attack symptoms is how they can differ between men and women. For decades, our understanding of a heart attack was based almost exclusively on research conducted on middle-aged men. This led to the universal image of the man clutching his chest. While this is certainly a common presentation for men, we now know that women, and particularly older women, are much more likely to experience a different cluster of symptoms. While women can and do experience the classic chest pressure, they are significantly more likely to present with the atypical signs as their primary complaint. This includes that profound shortness of breath we discussed, the pain in the jaw or upper back, and the intense nausea or indigestion. But there is another symptom that is especially prevalent in women: overwhelming and unusual fatigue. This isn't just feeling a little tired at the end of a long day. This is a deep, debilitating exhaustion that can come on suddenly, for days or even weeks leading up to the event. A woman might feel so tired she can't even walk to the mailbox or complete a simple task like making the bed. It's often described as feeling like you have a severe case of the flu, but without the fever or body aches. Because this fatigue can be vague and may come and go, it is tragically easy for women to ignore it, or for their doctors to dismiss it as a sign of stress, depression, or simply getting older. We must burn this into our collective consciousness. For a woman, jaw pain, back pain, shortness of breath, nausea, and a profound bone-deep fatigue are the equivalent of a man's classic chest pain. They are 5-alarm fire bells that demand immediate attention. Now that we have a thorough understanding of the wide array of potential symptoms, we must talk about the single most important part of this entire discussion: the action plan. Knowing the symptoms is useless if you don't know what to do when they appear. The plan is simple, but it requires courage and a commitment to prioritize your life over politeness or a desire not to cause a fuss. The very first, non-negotiable step is to call for emergency medical services immediately. In the United States and Canada, that is 911. In the UK, it is 999. Know the emergency number for your country. Why is this so important? Why not just have a family member drive you to the hospital? The reason is simple. The ambulance is a mobile emergency room. The paramedics who arrive at your door are highly trained professionals who can start life-saving treatment the moment they reach you. They can administer oxygen, give you an aspirin, start in 4, and most importantly, they can perform an electrocardiogram, or EKG, to confirm that you are having a heart attack. They can then transmit this information to the hospital, so the emergency room and the cardiac team are ready and waiting for your arrival. This can save an incredible amount of time. And remember, time is muscle. Driving in a private car, you can get stuck in traffic, and if your heart were to stop beating, there is nothing your loved one could do. In the back of an ambulance, the paramedics have a defibrillator and the skills to restart your heart. There is no debate on this point. Calling for an ambulance is the single safest and most effective way to get to the hospital. While you are on the phone with the dispatcher, they will guide you. They may ask you to take an aspirin. If you are not allergic, have no bleeding problems, and have been told by your doctor that it is safe, you should chew one full-strength, 325 mg aspirin. The key word here is chew. Chewing the aspirin allows it to be absorbed into your bloodstream much faster than swallowing it whole. Aspirin works by making the platelets in your blood less sticky, which can help prevent the blood clot in your artery from getting any bigger. It is a simple but incredibly powerful intervention that can significantly improve your chances of survival. After you've made the call and taken an aspirin, what should you do while you wait for help to arrive? First, stop whatever you are doing and sit down. The best position is often on the floor, leaning your back against a wall or a sturdy piece of furniture. This prevents you from falling and injuring yourself if you become dizzy or lose consciousness. Next, if you are wearing any tight clothing around your neck or waist, loosen it. This can make breathing a little easier. One of the most practical and important steps is to unlock your front door. It's a small detail that can save paramedics precious minutes, preventing them from having to break down a door to get to you. If you have your medical information and a list of your medications readily available, perhaps in a vial of life, on your refrigerator, that is also incredibly helpful. The final, and perhaps most difficult, task is to try to remain as calm as possible. Panic causes your body to release stress hormones, which makes your already struggling heart work even harder. Focus on taking slow, deep breaths. You have done the right thing. You have activated the system. Help is on its way. Your only job now is to rest and wait. Let's summarize the core message of our journey today. A heart attack does not always look like it does in the movies. It is a master of disguise. For a senior, the warning sign might not be a crushing chest pain, but a sudden shortness of breath while watching television. It might not be a pain in the left arm, but a persistent ache in the jaw. For a woman, it could be a wave of nausea and a feeling of overwhelming fatigue that makes her feel she can't go on. The definition of a potential heart attack symptom must be broad. It is any new, unexplained, and persistent sensation anywhere in your upper body, from your navel to your jaw. Your mantra must become, when in doubt, check it out. The fear of being wrong, of calling an ambulance for what turns out to be a simple case of indigestion, must never outweigh the risk of being right and doing nothing. An emergency room doctor will never be upset that you came in with a false alarm. They will only be heartbroken if you arrive too late. This knowledge you now have is a responsibility. Share it with your spouse, your friends, your children, and your neighbors. You could be the one who recognizes the subtle signs in someone else. You could be the calm voice that insists on calling for help. Understanding these symptoms is not about living in fear. It is about taking control. It is about replacing panic with a plan, and uncertainty with the quiet confidence of knowing exactly what to do. Your heart has been beating for you every second of every day for your entire life. Learning to listen to it is the greatest gift you can ever give back to yourself.